Okay. Hi, Katie. I'm your intern, Castro. I'm going to be your student doctor here at Parker Clinic. From the information I gather is that you're coming in with left knee pain, which had never happened before. You haven't seen or have received any kind of treatment in the past. The pain began about 2 weeks ago, and the pain was just kind of gradual. It comes on and off depending on the activities you're doing at home or at the time. You have described the pain as sharp when running and going up the stairs, achy when you sit down for a long period of time, and your left knee will make those a little bit of grinding noises. Not much makes your knee pain feel better other than resting, but the pain comes back with sitting longer than about 90 minutes. You notice that when you're going up the stairs, um, when you sit down for long periods of time, so roughly around the length of a movie, which is about 90 to 100 minutes. When you run for about 1.5 miles, I'm aware that you started training for a half marathon about 8 weeks ago. That's amazing. Props to you. That's a lot of commitment. But as I'm just ended up paying, doesn't really allow you to run for further than 1.5 miles. So I'm really sorry to hear that. Running a marathon is a huge deal. So I'm very proud to go ahead and commit to that, and also just to go ahead and come in and get yourself checked out so you can go ahead and fully do that goal. So. You're currently taking a cytoplam, which is getting monitored by your primary, from my understanding. You've been using it for about 4 years since you started college. I just wanted to ask you, how is that going? How's that condition going so far? Okay, good. All right, and so what you heard is correct. Exercise can definitely help with depression. I understand that's one of the reasons why you wanted to go ahead and do that marathon, just to go ahead and exercise, get that depression. Pushed away. I have read a book recommendation. I know you're in college, but I just thought it would be really cool for you just to go ahead and have that in your toolbox. But yeah, the book recommendation is called Exercise for Mood and Anxiety Proven Strategies for Overcoming Depression and Enhancing Well-Being. You'll find great information there. And if you have any questions or concerns, feel free to talk to me, reach out, let me know what you might be thinking. Something that caught my attention is that you're currently drinking beer and wine with your friends 3 times a night, averaging 5 to 6 drinks a week. I would suggest go ahead and talk to your primary about that. Just a combination of prescribed medication and alcohol. All right. So moving on, the problem seems to be located, and actually before I even jump into um, what the problem seems to be, did I get everything right? Do you have any questions or anything to add or anything that I got wrong? Okay. Hi. So, moving on, I'm gonna go and explain what, just basically based on the all of the examinations that we did last time, the problem seems to be located behind your kneecap. So remember, all those ortho tests that I did on you, they were not very fun. So they're actually really helpful. They help us narrow down what part of the body seems to be causing the pain. So it really helps us narrow down what kind of structures, like the tissues, like for example, it might be a muscle, a tendon, and that kind of stuff that happens to be very helpful to me. So, um, the pain on your so this is for the pain on your left knee. So the noises that you're experiencing when you go into that deep squat or might be getting out of a sitting position for a long time or even going up the stairs are because there is an issue behind that kneecap. We call this chondromalacia patella in my field. So this can be caused by several reasons. So this seems to be like a problem behind the kneecap, so the patella, that cartilage, that seems to be the issue. For a definite diagnosis, we would use something like a CT scan or an MRI. So this is just fancy words to say like imaging. So we'll go ahead and confirm that diagnosis with that. As far as right now, that is not necessary. I understand that you're gonna go and run your marathon in about 3 months from now, and you are concerned that you might not be able to complete it. So I want to go and let you know that at the end of the treatment, which would take approximately about 4 to 6 weeks, you'll be able to run your marathon. So before I get into the treatment, I would like to go over and address some of the depression symptoms as they could go ahead and delay that recovery. So again, I would highly suggest go ahead and talk to your primary doctor regarding that subject. But while you're here with me in office, we're gonna go and be doing a combination of therapy, starting with taping for pain relief. This is not something that's gonna happen forever, but it's gonna happen for about 4 weeks. It's just not a long-term solution, but it will help you feel better. Along the taping, we're gonna go and be doing a combination of physical exercises. And don't worry, I'm gonna go and talk to you the whole way through. I'm gonna let you know why we're doing it, why I'm making you do all this crazy stuff. But it's basically gonna go ahead and target the surrounding tissues. So with the help of taping and exercises, we can go ahead and get you fully recovered and help you go ahead and make sure you run that marathon. I know that's very important to you. Also just sitting for a while. I know like when you're in college, you're just sitting for long periods of time. It's also gonna go and help you with going up and down the stairs without a problem. I know you mentioned that your aunts had a knee replacement. Well, genetics do predispose you to certain developments. I want to assure you that what you have is very common with people who run often, and I'm not fully sure what the history of your aunt is, but we can go ahead and definitely make time and dig into that a little bit deeper. But as of right now, it is very common what you get. Flare-ups occurred along the way. It's normal. Healing is not a straightforward line, but you will feel better after treatment. As any other makeup procedure, there are risks, and you might get a skin rash with the tape, with exercises, and with the tape, we have different kinds of tapes to go ahead and make sure it fits your skin type. And then with exercise, we do get little micro tears, so that's when you feel that soreness after an exercise. So after appointments, you might feel a little sore, and that is completely normal. So if that happens, we're just gonna be in communication with each other. I can go ahead and definitely help you out with things that you can go and do at home with that. But yeah, how does all that sound?